Okay, so here today we have a situation where I've already introduced myself to the patient. I've verified that he is who he says he is. And upon looking at his medical record, I see that he's having a little bit of trouble getting acclimated to getting up into the upright position. So what we decided to do was put the patient on a tilt table today. And what we're wanting to do is first measure the vital signs before we get started with anything, just so we can establish a baseline. And another thing that I noticed in the patient's file was that he was non-weight bearing on his right side. So what I want to do is place this wooden block underneath his left foot, which is of his weight bearing leg, so that when he gets upright, his non-weight bearing leg never hits the floor. And as far as the way the patient is oriented, you want to have a pillow under his head until he reaches the upright position, and also a pillow or towel roll underneath of each knee. And then we'll get started with the straps. And with the way the straps work is if the patient has good trunk control, then you don't need a abdominal, which is this middle strap, or the thorax or chest strap. But if the patient does have poor chest or thorax or upper extremity control, trunk control, then you're not only going to be able to use just the abdominal strap, but you're going to need the chest strap as well, because the patient could experience the sensation of falling forward once they reach a certain incline level. So we're going to get started, and when you strap the straps over the legs or anywhere, you want to make sure that this metal part of the buckle doesn't touch any of the patient's skin. You want to make sure that they're strapped in pretty nice and tight so that they're not going anywhere once you start the incline. And in this instance, I'm going to put on the chest strap. Even though this patient seems to demonstrate decent upper extremity and trunk control, we're just going to be a little extra cautious here. Again, making sure that the metal doesn't touch any of the patient's skin. And then upon the incline, I'm going to start taking it up, and I'm going to take it to about the 75 to 80 degree mark. We're going. And I'll use this right here. It tells you about what angle that the table is going to be at. And here I am, I'm stopped at 75 degrees, and then I will again check the patient's vital signs and leave him here for about 15 to 20 minutes in this position so that he can get used to this upright position.